Okay, thank you for your introduction, Dominique, and thank you for your presentation, Dr. Duelos. Now that we know about the structure and function of exosomes, let's talk about what they can do for us. Hello, I'm Dr. Maya Oh from South Korea, and I would like to talk about clinical uses of exosomes in Korea, focusing on the aesthetic perspective. Therapeutic potentials of exosomes will be reviewed after my presentation by Dr. Magalon. First, I would like to introduce myself briefly. I am currently the director of our skin clinic, and besides my medical career, I worked for the government, reviewing medical devices, and worked at the industry for several years. There are several exosome indications, but I would like to focus on medical aesthetics, and I would like to focus on 4 indications. The first is scar remodeling. This is the schematic diagram of mechanisms of exosomes in scar remodeling. MSCs, or mesenchymal stromal cells, derived exosomes from umbilical cords showed enrichment in specific microRNAs, including microRNA 21, 23A, 125B, and 145. They target the TGF-beta2 MAD2 pathway to inhibit the differentiation of fibroblasts to myofibroblasts, resulting in reduced excessive fibrosis and scar formation. Another paper summarized the mechanism of exosome regulation in scar remodeling. It also summarized that exosome inhibited the differentiation of fibroblasts to myofibroblasts, leading to decreased scar formation and fibrosis. Human umbilical cord-derived exosomes accelerated re-epithelialization, reduced scar width, and boosted angiogenesis. So MSC-derived exosomes could regulate fibroblasts, collagen deposition, and promote scarless wound healing. The second exosome indications for medical aesthetics is pigment regulation. Since Koreans desire a fairer complexion, we call it lightening or whitening, and many patients receive laser toning to remove and decrease pigmentations. Applying exosomes after laser toning is quite helpful for pigmentation regulation. The mechanism is quite complex. After exposure to UVB, the keratinocyte-derived exosomes modulated their microRNA content to increase the intracellular melanin content of the melanocytes via MIR 3196 and MITF-dependent signaling pathways, or MIR 203, and MITF-independent signaling pathways. The microRNA 3305P overexpression in keratinocyte-derived exosomes decreased the melanin production and tyrosinase expression in melanocytes. So, in conclusions, exosomes may be helpful for pigmentation, regulation, and inhibition. Third is hair growth. Exosomes derived from human DPC, dermal papilla cells, promoted viability of DPCs, or outer root sheath cells, and hair follicle stem cells. They increase the expression of IGF, insulin-like growth factor 1, keratinocyte growth factor, hepatocyte growth factor, beta-catenin, and sonic hedgehog. And they also accelerated the onset of hair follicle anagen, postponed catagen, and facilitated hair shaft elongation. But the main reason I use exosomes in my clinic is for skin rejuvenation. I combine exosomes with skin rejuvenation procedures for younger looking skin, and it is quite effective, and patients come back, which is very good for the clinic. Exosomes could improve function of keratinocytes and fibroblasts, enhance collagen and elastin synthesis and increase dermal fat, thus promoting the regenerative and restorative capacity for skin anti-aging. The regenerative potency of exosomes are due to its angiogenetic ability, collagen synthesis, and the regulation of inflammation. Increased collagen and elastin synthesis and decreased inflammation are key mechanisms in skin rejuvenation. Also, decreasing the genotypic and phenotypic changes of photo-aged human dermal fibroblasts and reversal of senescence of human dermal fibroblasts also aid in skin rejuvenation. This makes exosomes an effective anti-aging treatment because it ultimately enhances the synthesis of collagen in the skin, improving its elasticity and reducing the appearance of wrinkles. So in Korea, there are many commercially available extracellular vesicles and exosomes, including what is written in this table. But since the topic today is clinical uses of exosomes in Korea and new product may be of more interest, I would like to introduce exosome products that are manufactured and currently commercially used in Korea. I know that plant exosomes are a little different. It's interesting that since we use the term exosome and plant exosomes and they are commercially introduced, I included plant exosomes in my presentations. The plant-derived nanovesicles are something different, but they're gaining quite a lot of interest in Korea because people are more comfortable with exosomes that are derived from the plant. So there are lots of commercial products that claim that they have used plant exosomes. Now, these are cosmetics for general use. In cosmetics, lactobacillus extracellular vesicles, human stem cell conditioned media, and also plant exosomes are used. The constitutions may vary. For example, Ampel's exosomes are derived from young, healthy honey's microbiome, while Medicubes contain spicules, which claim they can go deeper into the skin. Some home care products include MTS needles, and some have 2 vials that has to be pre-mixed before the application. And these products are all home care products that the individual consumers use and that may be administered by the patients individually at home. But next are skin boosters for in-clinic use. These skin boosters are used in clinic by doctors, and they contain plant exosomes explained before and human adipocyte conditioned media, and they are effective for prevention of skin trouble, aging, improvement of skin tone and texture, reduction of skin pore and wrinkles, replenishment of skin moisture and elasticity, and strengthening the skin barrier. Finally, I would like to briefly go through my exosome protocol, which is very simple. I do little work while the exosome does the rest. I do agree that injection is much more effective, but this is a translated screen capture of a Google page. Injecting exosome is not allowed in Korea, and starting 2022, which is 2 years ago. Exosomes were frequently injected 2 years ago, but since 2 years ago, the press and YouTube emphasized that exosome injections are illegal, and some doctors were even investigated by the police after the patients reported them to the authorities. So now doctors in Korea do not inject exosomes, and most of the patients are aware that exosome injections are not allowed, and some patients are waiting to report them to the police. So we do not do injections, except maybe with our families.
Not anymore.
Not anymore. So in my clinic, after cleansing the patient's face, topical anesthesia is applied for 15 to 20 minutes. If the patient is sensitive or is afraid of pain, then sometimes it's applied for more than 40 minutes, 1 hour maximum. Applying exosomes directly after skin rejuvenation treatments like fractional laser. This is an Urban-Miak fractional laser, and or microneedling, radiofrequency microneedling, and microdermabrasion also aids in the healing process. So also this approach, applying exosome directly after the procedure, helps to mitigate the symptoms associated with these procedures, including erythema, edema, and discomfort. After I apply exosomes, exosomes are further absorbed with ultrasonography, and after final touch with soothing moisturizers, the procedure is finished. This procedure is repeated every 2 weeks for at least 3 times, and many patients find this procedure not too difficult, but quite effective. And I also use it in combination with other procedures, such as whitening procedures like laser toning or fractional lasers, and the result has been very good so far. So finally, the take-home message. The exosome indications for medical aesthetics include scar remodeling, pigmentation regulation, hair growth, skin rejuvenation, and I mainly use exosome for the 4th indication, which is skin rejuvenation. There are many Korean exosome products which are cosmetics for general use and skin booster for in-clinic use. And as said before, they use a variety of exosomes, including lactobacillus extracellular vesicles, human stem cell conditioned media, and plant exosomes as well. And as said before, in my exosome protocol, I do little work and exosome does the rest. Thank you for your attention.